Hello everyone, my name is Dr. Priyanka Saukar Navle. Today I am making this video especially for patient who ask her what is composite filling material. So composite filling material is aesthetic restoration which is most commonly used nowadays in dental practice, since it has all the advantage of any restorative material should have. First thing, it is tooth colored, that's why we can use in the anterior or front teeth. Second thing, it got very good compressive strength, because of that it can be used in the posterior teeth where the biting forces are quite heavy. Third, it can be used for the core buildup. Fourth, it can be used for as a indirect or direct build up for the anterior teeth, like a laminates or veneers. It looks very nice, and since for shades selection also there are multiple options available. All the shades of the front teeth, almost all shades are available in composite filling material. So because of that also very natural looking tooth material, and when we restore it, it is looks very natural, like just like a natural teeth. So that is one more advantage. There are certain types of clear cut areas where composite material can be used. It is mostly anterior teeth, posterior teeth, core buildup, sometimes with the feelings where the front teeth are most commonly visible, but simultaneously where we don't have to do the much of cavity cutting, since cavity cutting required for composite material is very less, so it can be used in those areas. It has chemical, it sets with the light, blue light, okay, ultraviolet lights. Because of that also the normal setting instruction what we give for the other filling material like GIC, we ask patient to take certain precaution for 48 hours to 2 days, like don't eat this, don't eat that, don't chew food too hard on the posterior teeth. For composite material such type of instructions are not there, since the moment we press the light button, the blue light, material sets automatically, so all those instructions are very less. What are the contraindication, what are the drawbacks of composite filling material? So first drawback, comparatively it is slightly costly when we compare with the amalgam and GIC filling material. Second, since this material does not bond with the tooth surface chemically, it bonds with the mechanically, so it does not have that advantage with GIC has over the filling material. Composite does not bond to the tooth surface chemically. Third, it does not have anti-karyogenic properties. Fourth, since it is white colored, we need to maintain it properly, we need to maintain the oral hygiene properly. These are the 3-4 drawbacks of the composite filling material. But again I want to highlight one more thing, the composite filling material nowadays is most commonly used material, and it got all the good advantages of the any filling material that we are currently using. So yes, obviously it is a choice for dentist based choice material for the filling material of anterior teeth as well as the posterior teeth. Hope this video must have cleared your mind about the composite filling material and what are the indications, contraindication, where to use and how to use. Do like my channel guys, subscribe it. Bye bye, take care.